I think is really important. Last November, the cities of Orange, Anaheim, and Costa Mesa sought the assistance of a San Diego County Superior Court judge to block a mobile program that provided a needle exchange opportunity. The request was granted by Judge Joel Wilfeld, and I'm not here to debate the efficacy of a needle exchange program. What I want to address is local control. If a city has an ordinance or has done a resolution to allow needle exchanges, then nonprofits have the ability to bring their mobile services into that city. If the city does not have a resolution or an ordinance, then the nonprofit should seek permission. Elected city leaders should not be forced to litigate if they oppose unilateral establishment of needle exchange services. Judge Welfeld understood the noble goal, but the potential unintended consequences or the seriousness of the harm outweighs the social utility of the program. Senate Bill 689 addresses needle and syringe exchange programs and provides a solution. When the State Department of Public Health authorizes certain entities to provide hypodermic needle and syringe exchange services in any location where the department determines, it should do so with the explicit collaboration of the cities, counties, and city and county. If the city adopts an authorizing ordinance or resolution, the State Department of Health has a green light. My bill, SB689, provides the protocol for collaboration between Sacramento and local bodies. It should prevent surprises and unnecessary litigation. It should also affirm the appropriate etiquette and addressing important health issues facing the communities like HIV, viral hepatitis, and other potentially disabling infections. I am honored today to have Orange County's new district attorney, Todd Spitzer. As a former state assemblyman, as a former county supervisor, he appreciates the importance of state and local relationships. He will be followed by Orange Mayor Mark Murphy, Orange City Councilman Chip Monaco, Anaheim City Councilman Trevor O'Neill, and Costa Mesa City Councilwoman Sandra Guinness. District Attorney Spitzer, it is an honor to have you here today. Welcome.
Thank you, Senator. Thank you very much. Appreciate it. So, good morning. I want to thank Senator Moorlach for his leadership in this area. He and I served on the Orange County Board of Supervisors together, and I think we agree that local control is one of the most important aspects of governing. You know, this morning I went to 2 independent retail pharmacies to find out how difficult it is to purchase syringes. This is a 10-pack of insulin syringes. And present state law, here's the law as distributed by the state of California. It legally requires pharmacies in the state of California to distribute syringes without a prescription. Today, under California state law, there's actually no limit to the number of syringes anybody can walk in off the street and purchase. It does not even limit the gauge of the syringe. So for example, at the 2 pharmacies I went to this morning, both of them will distribute a 10-pack of an insulin syringe. Now, my son is a type 1 diabetic, and he uses these types of syringes. This type of syringe is for an injection into your muscle. It is not an intravenous use syringe. It doesn't have a big enough gauge. So one of the reasons that this argument about local control is so important is because we adamantly object to the wholesale distribution of syringes by mobile vans moving through our community at their own discretion, whether it's at playgrounds or in front of schools. We adamantly object to that. And as a county supervisor, we were successfully able to sue the needle exchange program, and we stopped it in its tracks. no pun intended. We stopped it because it failed to get community buy-in. When we cleared the riverbed and when we cleared the civic center of the homeless population, we collected hundreds of thousands of syringes. Even though my son is a type 1 diabetic, we take precautions at home to ensure that none of us are inadvertently stuck by a needle that my son has used. So think for a minute what it feels like to be a member of the public walking through our community and seeing thousands of these needles littered throughout our areas of public access, when we know that people have been stuck by these needles. I want to clarify something very clearly about Senator Morlock's bill. Do not think for a minute, if this bill is passed and signed by the governor insisting on local control, that your local boards of supervisors or city councils will not pass ordinances to allow for the distribution of needles. This is not a bill, in my opinion, to stop the distribution of needles. It's a bill to oversee the responsible distribution and collection of needles. This morning when I went to 2 retail pharmacies, they only distribute the needles. They do not collect the needles. There's a serious problem with that if you think about that. That means we're only putting more needles into the mainstream and into the public litter area. If pharmacies are not collecting it and the needle exchange are not collecting the needles, we have no way to know or to secure the fact that these needles also, after their use, need to be collected and properly disposed of. This needle has the ability to kill another human being. Not through the process of getting inadvertently stuck by it, but it has the ability to kill another human being if you get a disease that is transmitted by this stick. So if you are inadvertently stuck and this needle contains HIV or contains hepatitis, which we know these needles oftentimes do contain, it means we are all in danger. So no one doesn't want to be empathetic or sympathetic to an addict who both needs help and understands that they're trying to deal with their addiction. But no one should ever have to face this instrument in a public place and get hurt or stuck by this needle, which could kill them. Thank you very much, Senator Morlock.
Well, thank you. My name's Mark Murphy. I'm proud to be the mayor of my hometown, the city of Orange. And I so appreciate Senator Morlock bringing this legislation forward. We felt a bit hampered and put upon last year when this program was reported to us and really saw no way other than going to court in order to stop it. This is not a program that hasn't been tested in Orange County. It was tested in the city of Santa Ana. It ran for multiple months, and at the end of it, both the public safety as well as the staff in general said they would not renew due to the risks and the issues that have already been eloquently described. I mean, just as an example, the riverbed area, the numbers of needles in the cleanup were over 14,000. And if you did the math on this program last year, they were accounting for about 250,000 needles to be distributed in the city of Orange. That's not all 4 cities, that's just the city of Orange, without a real defined way to ensure the public safety. I too am not trying to argue the health benefits. I just would ask, one, that Orange has a say along with my fellow municipalities in the county, but 2, that if this program is going to continue, it continues in a responsible fashion that protects the safety of our local citizens. So Senator Morlock, thank you. The city of Orange is 100% behind, and I'm sure my colleagues are as well. So thank you very much.
Thanks, Senator Morlock. I'm Trevor O'Neill, Anaheim City Council member. You know, since California allowed easier needle access in 2015, Anaheim has had to deal with tens of thousands of needles strewn about our streets, our parks, and our public places. Last year, when we cleared the homeless encampments in Anaheim's stretch of the Santa Ana riverbed, as Mayor Murphy pointed out, over 14,000 used needles were recovered. After opening our first emergency homeless shelter just this last December and clearing out encampments from La Palma Park, alone we recovered 115 needles from that site. And last October, an 8-year-old boy was pricked by a used needle while playing in Manzanita Park. Now, we acknowledge the public health objective and good intentions of needle exchanges, but we fear we're trading the health risks of sharing needles for a greater health issue, exposing the unsuspecting public to carelessly discarded needles. No one should have to worry about encountering a used needle at a park, on the sidewalk, outside of a school, or anywhere else. And furthermore, sadly, easier access to needles has compounded the issue of homelessness in Anaheim. In Anaheim, we already provide many resources for residents struggling with addiction, Drug-Free Anaheim, our partnership with CityNet and others. And in fact, some of these organizations believe that the needle exchange programs can actually harm addicts because they offer needles without engaging in any kind of rehabilitative services, essentially feeding the drug problem instead of treating it. Now, as a city, public safety is our #1 responsibility, and Anaheim has made it clear our very real concerns about the proliferation of needles in our city. Our city council is on record opposing the state's needle exchange program, and we support the intent of Senator Morlock's legislation to ensure local control and ensure that we have the ability to address these issues within our own city. A top-down, one-size-fits-all approach coming out of Sacramento to an issue as serious as needles is bad for Anaheim and bad for cities across California. And that's why at my earliest opportunity, I intend to bring forth a resolution to the Anaheim City Council to sign on in support of Senator Morlock's SB689. And I encourage my council colleagues throughout Orange County and California to do the same. Thank you, Senator Morlock, for addressing this issue and carrying this very important piece of legislation.
Hi, I'm Tamara Jimenez, and I represent Anaheim Lighthouse. We're a treatment center for substance abuse who has been here in Orange County for about 20 years. And let me make myself very clear. First of all, thank you, Senator Morlock, for having me here today. But let me make myself clear. When people say harm reduction and they use that term, it absolutely has nothing to do with addiction. They are talking about the spread of disease. There is no such thing as harm reduction when it comes to addiction. Addiction it's no secret to anybody right now in the US that we have an addiction epidemic right now. We have close to 200 people a day in the US dying from drug overdose deaths. That is not a secret. The studies that have been done that say that it's a good thing or whatever, those were pre-fentanyl days. We have fentanyl now that is killing people by the hundreds and the thousands. So it is very dangerous. And if that fentanyl happens to be in a needle that a child or even adult gets pricked by, they're probably going to die. Addiction is a chronic, progressive, and fatal disease. There is no such thing as doing a little bit of heroin, doing a little bit of meth. That's not how it works. It is chronic, progressive, and fatal. You need complete abstinence along with treatment or 12-step programs, things of that nature to help you through that and to help you recover. And by giving local control to the cities and the municipalities, that will allow them to provide resources for those types of things. Because if you're going to be distributing needles, you absolutely have to couple that with giving people the opportunity to choose treatment over killing themselves. Thank you so much.
I'm Sandy Guinness, Costa Mesa City Council, one of the cities that brought suit to stop this program in our city. I am so grateful to Senator Morlock for sponsoring this bill. We first learned about the proposed needle exchange in the city of Costa Mesa from an article in the LA Times. We were not contacted by the applicants. We were not contacted by the state. That's totally unacceptable, where you have an issue that could result in severe impacts to your community, health impacts, solid waste impacts, both due to the needle exchange, the wound care kits, the condom distribution, and so forth. Police impacts, traffic impacts from a mobile van that's going to stop wherever. We were not contacted in advance. We were not consulted in advance. That is wholly unacceptable. I am not an advocate of the needle exchange. The Costa Mesa City Council is on record as opposed to the needle exchange. However, even if we found a needle exchange to be an acceptable use in our city, you would expect someone to come in, ask where the best area of town would be, coordinate your waste control, coordinate your public safety, but we got none of that. I am just amazed at the cavalier attitude towards Costa Mesa. When I finally was able to attend a workshop in another city, as a matter of fact, not in Costa Mesa, and I asked about waste, the sponsors of the program suggested that we, the city, provide additional waste receptacles, not them. And so there's a lack of responsibility. Costa Mesa has the most sober living homes of any city in the state of California. We have people who are struggling to get sober. Hundreds and hundreds of people in Costa Mesa who are struggling to get sober, to kick a dope habit. And there's a proposal to pass out needles right outside one of the counseling centers. That makes no sense. And do we want to increase the struggle of people who are trying to get sober? I hope not. There also was a lack of understanding of our community. The application said there were no residents in the area. Not only did we have numerous single-family residences, senior mobile home, so that elderly people with compromised immune systems would be vulnerable. We had an elementary school right in the area proposed for the needle exchange. Clearly, there was no consideration for our community, a lack of understanding of our community, and not any real interest in being responsive to the needs of our community. And so even if you were in a situation where you found this an acceptable use, which I do not, you certainly should from day one talk to the people in the city, coordinate with the people in the city, find an area that's away from elementary schools, away from homes, away from senior housing. But we saw none of that, and that's why I am so grateful to Senator Morlock for sponsoring this bill, because we need to have local control when we have local impacts. Thank you.
I want to thank all of my elected leaders that have come out today. We have copies of Senate Bill 689 and our fact sheets available to the public, and we are excited about providing a proper decorum, a proper relationship between Sacramento and its 482 cities. So thank you for coming out today, and we're ready to answer any questions you may have. Usually KFI asks a really good question, so I'm waiting.
Oh, you're waiting for me?
Yeah.
So, since I'm on the spot making up a question, why don't you tell me again about the impact and why the importance of not like, I guess, working with the state to come up with something that everyone would agree with, that both covers the waste and covers the issues of local control?
Yeah, kind of expand the purpose of the bill. The first step is, let's just at least build some bridges to start working between the state and the local cities and municipalities. Sacramento has been trying to impose a lot of new rules, on what a city should build and what it should do with its properties. And if you're not building enough homes, we're going to sue you. And it's gotten a little interesting. And we're kind of saying, hey, time out. If the code is silent on how you are supposed to have a protocol, then they can do whatever they want. So now if we put a protocol into the code that says, no, you have to meet with the city leadership first, then that's a good first step, and then we can start working on all the other issues as well, as opposed to having it unilaterally imposed.
And a couple people that have spoken have also mentioned that they are not a fan of the needle exchange program to begin with. So in place of that, if this were to go away, is there something else that could be? I mean, are these cities proposing that they're going to have their own needle exchange programs and waste programs along with addiction services? Or is, I mean, obviously the idea could be that nothing would be there if this program went away.
Well, you have city councils, 34 here in Orange County, and they deliberate, and they can put the item on their agenda, should we allow for needle exchange programs to come into the city. So every city is going to be a little different. So let's say 3 or 4 approve a resolution or an ordinance. Well, now we have some places for people to go.
How'd I do?
Pardon me?
I said, how'd I do?
You know, John and Ken would be proud. Anyone else want to answer those questions?
Yeah, can I real quickly take a stab at it? Corbin, I don't see that at all. That's why I gave the example of the pharmacies today. There's no consistencies in how the pharmacies are already presently using state law. How hard is it to add in the code that if you're going to dispense needles, you have to collect a commensurate amount of needles? In other words, you can't just be distributing more needles into the waste stream. You have to be responsible as a distributor of needles to collecting needles. Under the ordinance or the rules that are distributed by the state of California, you don't have to distribute a sharp container when you sell needles. You only have to offer for sale a sharp container. Think about that for a second. Anybody who is a drug user and is going in to buy needles and they're not required to give needles back in order to get additional needles, the last thing on their mind is the proper disposal of those needles. So why isn't it if you sell needles, then you're also required to dispense as part of that transaction a sharp container? I'm not saying people will necessarily use it in every instance, but if we allow local control, then every city can work with their local pharmacies, which already has a distribution mechanism to distribute these needles. And we know that those are licensed healthcare professionals. Sandy Guinness knows from Costa Mesa, when we were working on that with the Board of Supervisors, that the individuals that were working for the University of California, Irvine are students, graduate students, who may be studying to be healthcare professionals. Many of them were being studied to be criminology majors. So there's no specific training through the needle exchange program for any individual who's working in that capacity. This is a healthcare issue, and it should be supervised by healthcare professionals.
So I had a 40-minute phone call with the state, the Office of AIDS, when they approved this, when they approved the mobile units. And I asked a lot of questions, like I said, 40-minute phone call. And what I found out from that office is that there's no age requirement. I literally said, so an 8-year-old kid can walk up to this van that's doling out needles and can get them? And they said, yeah, we don't regulate that. I said, do you track the needles? So if my kid is playing in the park and gets pricked by a needle, is there any liability for the medical bills that I'm gonna have to pay for my child? No liability. We don't track the needles. We don't find that that's effective. I said, do you require people to talk to a licensed counselor or therapist, certified counselor? No, if they ask for resources, we can give them a list. The needle exchange that was operating here in Orange County specifically, I had many conversations with them, and what they were doing when they were in Santa Ana, they were giving out 200 needles per person, per exchange, but you did not have to have any needles to exchange whatsoever. That's a needle mill. That's not an exchange. And I calculated it, right? I'm like, wow, that's enough to basically shoot up with a clean needle 28 times per day. Those of us who are in the treatment world, in the treatment industry, understand that or even people that are in recovery, the average amount of time somebody will shoot up is maybe 3 to 5 times a day. Nobody is shooting up 28 times a day. This is for distribution. So there's pretty much no regulations, really, is what it is. And, I actually brought a mayor out from West Virginia, Danny Jones, who has dealt with this out there in Charleston. And he shut down the public health one. And there's another one that stayed open. But there was multiple things that had to go with that, such as retractable needles. So, and that touches on the public safety issue, right? Because if it's a retractable needle, you can't get poked by it, right? You can't, but those are more expensive, right? They cost more. But, I mean, how much are the children's lives worth, right? So retractable needles, requiring people to get tested so that they are informed whether they have HIV or hepatitis, so that they know when they go to shoot their dope, that they know that they're well informed on whether they are infected or not. Otherwise, you're doing, in my opinion, you're doing a disservice to those people, because you're doling out the needles, but they still don't know if they're infected or not. And so they go on, and I can tell you from the experience through working in the industry is that most people shooting dope, they really don't care if they're sharing the needle or not. They don't care whether disposing of it. They really don't. I mean, if you've ever seen somebody on heroin, they're like this, right? They're knotted out. It doesn't cross their mind to dispose of this in a safe spot or whatever. So to treat somebody as a patient, that's how they should be treated in a needle exchange. If you're going to well, first of all, if it's an exchange, it should be an exchange. 1 for 1, you bring in your needle, I'll give you another one, right? And to treat them as a patient and talk to them about treatment options, right? Give them that opportunity. Don't just hand them needles and maybe a list that's going to go in the trash can. So, those are some ways that the cities could look at doing this in a better, healthier, safer way.
Thank you, Tamara. Thank you very much for coming out. Thank you for the great questions from KFI. Have a great day. Thank you, CBS Channel 9.